Hello, everyone, and thanks for joining us this afternoon to hear more about cervical cancer and cervical cancer screening. My name is Anna-Marie. I'm from Healthwatch Bury, and our guest speaker, Alison Chapman, will be joining us shortly to talk about cervical cancer screening a bit more in depth. Before I hand it over to Alison, I will share some of the slides just to introduce some of the ground rules and talk about Healthwatch Bury very briefly. So if I share my screen. Stay with me. I hope you can all see this. So thanks again for joining. If I could, we welcome any comments on our Facebook page. Just please remember to be accepting, respect boundaries, don't be rude, don't flood the chat, don't self-promote, and please keep it clean. So the session overview today, what I'm doing now is just introducing Healthwatch very briefly, and I will hand it over to our guest speaker shortly. And at the end of the session, we've got a couple of questions from the members of the public as well. Who are we? Healthwatch is your health and social care champion. We make sure NHS leaders and other decision makers hear your voice and use your feedback to improve care. We listen to your experience of using health and social care services and share them with those with the power to make the change happen. We can also provide you with information and advice. So ways we can support you, we can signpost you to local or online support groups. We can also provide you with information and advice about you and your family members' healthcare. And we can listen to your experiences of using health and care services in Bury. Our contact details on this page, so feel free to give us a ring or send us an email. Without further ado, I will hand over to our guest speaker, Alison, and I'll stop sharing my screen.
That's great. Thanks, Anne-Marie. Okay, I'll just share my screen. Okay. So I've tried to mix this up a little bit. I look after patients in 9 GP practices, so I do all the different screening programs. And cervical cancer, unfortunately, is one that's fallen off the radar for people, which is unfortunate. So first of all, where is the cervix? So it's cervical cancer is the cancer that's found anywhere in the cervix. So it's between the opening of the vagina and the womb. So you can just see from that diagram there whereabouts it is. It's quite interesting to find out what the cervix actually does. It allows blood or our periods to flow from the vagina. It protects against infection by producing mucus to keep the cervix, womb, ovaries and fallopian tubes healthy. It thins to allow sperm to travel to fertilize an egg. And once that egg is fertilized, it then closes, allowing a baby to grow and stay inside the womb. When ready, so usually after 9 months or 40 weeks of pregnancy, the cervix then stretches and it softens, which allows a baby to be born. So it's got a lot of important jobs. So what causes cervical cancer or cervical cancer? It starts in the cells in the cervix. Cells are tiny little parts of our body, and the body makes new cells to replace old ones. So these cells die or are damaged. So the body's constantly producing new cells. Cervical cancer, it can develop on the outside of surface and inside of the cervix as well. The main cause of cervical cancer is a virus called high-risk human papillomavirus, more commonly known as HPV. And it sometimes causes changes to those cells we were talking about before. So as these cells are renewing and getting rid of the dead cells or the damaged cells, sometimes those cells can reproduce incorrectly, which can develop into cervical cancer. On average, it does happen very slowly, and it happens over a period of generally speaking, 5 and 20 years. So it's actually one, thankfully, that is quite slow growing. But as I say, what we need to be doing is to have these cervical smears just to make sure that those cells are reproducing healthily. So I'm going to play this video for us. So this describes a little bit more about HPV.
Sorry, Alison, I can't hear the video. Do you want me to add the link in the Facebook comments?
Oh, yes, please. I don't know why that's not.
Yeah.
So it's not playing the sound.
No, I
It's
can't
not
hear
playing
it.
the
No.
sound. Oh, right. Okay. Sorry about that. So it was just saying, and yes, if you wouldn't mind sharing the link, it was just saying that HPV is actually really common, and most of us have this virus within our bodies, and it doesn't actually cause any problem at all. Occasionally, for women, it does cause us problems, and we can't get rid of the virus. Again, it's all to do with those cells that are reproducing incorrectly, which is why it's important that we have our cervix checked to make sure that those cells in the cervix are remaining healthy, and not reproducing cancerous cells, for example. The main way we can protect against getting the HPV virus is to have the HPV vaccine. That's now offered to males and females between 11 and 17. So that's actually got really good results in the amount of the high risk HPV cells that it can stop from happening. So obviously I encourage those people within that age group to have the HPV vaccine. A lot of people that haven't had that should still have the smears. And even if you've had the HPV vaccine, you do still need to have your cervical smear tests. Okay. So, Anne-Marie, is that on my what is HPV slide with the video?
Yes, that's what I can see.
Yeah. Okay, thank you. So there is another video coming up. Oh, brilliant. There is another video coming up. So I won't play that. I'll just talk through it, and we'll allow the link to be shared as well. So most cervical cancers don't really show much in the way of symptoms, unfortunately. It's something that those symptoms might be very, very discreet, maybe quite unnoticeable. So it's really important that we know our bodies and we're highlighting anything that is slightly out of the ordinary. So abnormal vaginal bleeding. So when I put this, I'm referring to things like bleeding during or after sex, bleeding in between periods, having gone through the menopause and then us suddenly starting with periods again, any unusual discharge, any pain or discomfort, again, during or after sex, any unexplained lower back pain. Again, it might not be an obvious symptom, and it may not, none of these may indicate that you have cervical cancer, but they are things, it's just about being aware of your own body and knowing your own body, and anything that is out of the ordinary, getting some clinical advice. And as it says there are many other conditions that can cause these, but you should see a doctor if you're experiencing any of them. So oh gosh, put my teeth back in. Human papillomavirus is the name of a very common group of viruses. It's spread by all types of sex, and that does include things like sex toys as well. It's not just penetrative sex between male and female. HPV has no symptoms, so you may not know that you have it. It's really common. About 8 in 10 people will get HPV in their lives. And some of the cancers that can be linked to high-risk HPV include cervical, anal, penile, vulval, vaginal, and some types of head and neck cancers. So males and females 12 to 13 years are often are offered the HPV vaccine as part of the NHS vaccination programme. Some areas that may extend up to 17. The HPV vaccine, it helps protect against cancers caused by the HPV virus, including cervical cancer, some mouth and throat or head and neck cancers, some cancers of the anal and genital areas. The HPV vaccine protects against 9 types of HPV, which is amazing that it's actually protecting us against 9 types. So that's amazing. So cervical screening, also known as a smear test, checks the health of your cervix. It's not a test for cancer. It's a test to help prevent cancer. All women and people with a cervix aged 25 to 64 should be invited by letter every 3 to 5 years. In Bury, what we're starting to do is we send 24-year-olds a text message to say that they're going to be called for the first cervical screening and to expect that letter to come in the post. During the screening appointment, a small sample of cells will be taken from the cervix. The sample is checked for certain types of HPV that can cause changes to the cells of your cervix, and they're known as the high-risk types of HPV. If these types of HPV are not found, you don't need any further tests. So you'll just receive a letter saying that your results are normal, and that's it. If these types of HPV are found, the sample is then checked for any changes in the cells of your cervix. These can then be treated before they get a chance to turn into cervical cancer. Your results roughly take 2 to 6 weeks to come through. So even if you do receive notification that the cervical screening you need more tests, it doesn't mean that you've got cervical cancer. And that's the same with any of the screening programs. When you've been recalled, the majority of people don't go on to be told that they've got a cancer. So it's just to make sure. It may have been that the amount of cells wasn't adequate, so they needed to repeat the test. So try not to get too alarmed if something like that comes through. It doesn't necessarily mean that at all. So this is the other video. This video is a really good video. I know the volume wasn't playing for some reason, but Anne-Marie's going to pop that link on as well. This lady here is going to go through what happens during your cervical smear screening. So she'll show you the equipment that they use. She'll show you how the equipment's inserted into the vagina. She'll show you the little brush that collects the cells, and how quickly the whole process actually takes. It doesn't take long at all. So it is quite reassuring just to watch this video and to see exactly what to expect if you go for your cervical screening. So some screening tips. First time, and I remember my first time, I did feel embarrassed. I was worried. I was scared. I wish I'd have known that I could have asked for a longer appointment. I was absolutely mortified. Now, all right, we don't ever look forward to anything like that, but it's literally over in 5-10 minutes. It probably takes more time to get undressed and then dressed again. It takes longer probably than actually doing the screening test. So you can also ask a friend or a relative to come with you if you want. Just hold the hand, you know, if that makes you feel comfortable. Some people may be worried if they've suffered sexual abuse. Unfortunately, it is a way of life and that does happen. If that has been the case, if you're able to tell the nurse that you've unfortunately experienced sexual abuse, or you can just say I've suffered abuse in the past, can just make you aware of that. That's absolutely fine. There may be parts of your body that you don't want the nurse to touch when she's taking the swab that she might not even think about. For example, if she touches the inner side of your leg, we don't want to do something that's going to provoke any fear. So just let them know if you can, or even write it down and give it to them. Yeah. Avoid your period cycle, so they can't do the cervical screening if you're on your period. So obviously book the cervical screening at a time when you're pretty sure that it's not going to be your menstrual cycle. Select appropriate clothing. So either wear a long skirt or a long dress or a long top that you can keep on. It really does make a big difference. You just feel more covered up. You know that you're not, but you do just feel more covered up. However, just be aware, if you forget, it's not a problem. They give you some of the tissue that, you know, what they cover the couch with. So they rip some of that off and you just cover that over yourself. And again, as I say, it just makes you feel more covered up. It's just keeping that bit of dignity for those few minutes that they're doing that smear test. If you're going through or gone through the menopause, some people suffer vaginal dryness. There are creams that you can get from the doctor, so you can get it prescribed, that you could maybe use before you go in for your smear test. Make sure you tell the GP that this is ahead of going for your smear, so that they know to prescribe you the right thing. And as I said before, it only takes a few minutes. So we've got some useful links here. So we've got the Cervical Cancer Trust, which is Joe's Cervical Cancer Trust. We've got some screening information in different languages. And we've got Joe's Cervical Cancer Trust Guide to Cervical Screening as well. So it's hopefully you will find some of those useful and helpful. And I just encourage you all to bite the bullet, and it really isn't as bad as what you think. And we soon get used to it. And unfortunately, it's just something else that we have to do. But it is worthwhile going and having that done. Okay, I'll stop sharing my screen.
Oh, thank you for this. That was really, really useful, really informative as well.
That's
Thank
okay.
you. We've just got a couple of questions from the members of the public. If you don't mind answering some of these, I'll just get them up now. So the first one is around. So the person's asking, I have lost my cervical cancer screening reminder letter. Who do I ring to book the appointment?
Right. Okay, it's not a problem if you've lost the letter. It doesn't matter at all. Your cervical screening is actually done at your usual GP surgery. So all you need to do is ring up your doctors like you normally would and just say to the receptionist, can I book an appointment with the practice nurse? I want to have my cervical screening done, or my smear. They'll understand both terms. So just give them a call and get booked in.
That's brilliant. Thank you for that. Useful. Just a minute. So the next question that we have, the person is saying, I'm really nervous about attending screening. Is it really necessary for me to attend?
Yeah, absolutely. And like I said before, I can still vividly remember my first one, and it really wasn't that bad, but I built it up in my head to be something absolutely horrendous. And I've never felt as anxious as I did do that first time ever since, as much as we don't like having them. Everybody does feel scared, and it's just the unknown, isn't it? We don't know what to expect. And I always say to patients, that nurse will be having a clinic back to back doing smears all morning or all afternoon, or so that is all that they will see. They'll be looking at every different vagina, and they are not bothered what yours looks like. It's not painful. They're very, very gentle with you. They're very reassuring. If it's your first time and you haven't been before, again, I would say tell the nurse that it's your first time. Tell the nurse that you're really scared. And what they'll probably do, and again, maybe book a longer slot so that they can take that time with you. They're not feeling pressured to get to the next patient. So what they can do is, and again, I'm sorry, it's because I couldn't show the video, but they insert a speculum into the vagina, which is It's just a plastic tube that they insert, and they can use the smaller one. So if you're really worried about it, tell them, ask them if they can use the smaller speculum, which I'm sure that they will do. But it isn't painful, a little bit uncomfortable, but I wouldn't even say that really, to be honest. It's just so worthwhile getting it done. As a cancer care coordinator, I do see young ladies that are in the 20s and they've never gone to any cervical screening. And when their cancer has been found, it's been too far gone and they can't have any treatment. It's just about how long they've got left. And all right, most of us, luckily, when we go for the screening, we never get called back. I've never been called back. But then in those cases where their cervix aren't checked and they aren't certain that their cervix is healthy, and then by the time their body's showing them symptoms, it's too far for them to start any treatment. So it's really sad, and that does tend to be really quite young girls in the 20s, with their lives ahead of them. So I do see that. Thankfully, I don't see it a lot, but I wouldn't want that to be anybody. And unfortunately, it is, I know. But if we can just keep an eye on our cervix and go for these smears, and it's only once every 3 to 5 years. So if you think about it, it's 5 or 10 minutes every 3 to 5 years, and it's just nothing, is it?
Absolutely. I think it's really, really important to get checked. So thanks for that. It's very reassuring, actually, to listen to this. So we've got just one more question. So it's from the lady who's saying she's in her 30s. She recently got an invite to a smear test. However, when she arrived and told the health professional that she was sexually inactive, she was told she doesn't need a smear test and she was sent back home without carrying out the test. She didn't want to say anything at the time, but she's now feeling worried that this cervical cancer would get missed. And she's just asking if she's still in risk of developing cervical cancer if she's sexually inactive, and how to go about actually getting that appointment booked again if that's necessary.
Yeah. And unfortunately, it's a bit of a common myth, isn't it, that if you're not sexually active, then you can't get cervical cancer. It's not the case. Majority of cervical cancer and HPV is it's instigated by being sexually active. Sexually active may be penetrative sex with a human being, or it could indeed be with sex toys, for example. It doesn't have to be another person. So and then in some cases, you just don't know. So absolutely, she does need to have her cervical screening. I'd be really interested and more than happy to pick this up. If she doesn't want that, then I would suggest that she rings back the surgery and informs the surgery that she would still like her cervical screening done, and that she has been made aware that she can still get cervical cancer, unfortunately, even though she isn't sexually active. She's absolutely right to be alarmed and concerned. She does need that screening test done, and it's great that she's going and attending that appointment. What a shame that she's been turned away. Absolutely, she does need that, definitely.
Oh, thank you for this. We can follow up on that one, and I can get you the details outside of this meeting.
Yeah, that's
But
brilliant.
thanks again for attending and really, really useful information. So really appreciate everything today. Thank you.
That's great. Thank you so much. Take care, Anne-Marie.
Thank you. You as
Bye.
well. Thanks. Bye for now.